we want to talk about innovation in US healthcare in particular, because there's been more and more research and development funding, investment overall in developing new things of all kinds for the healthcare sector in the US. But it's a system which is notorious for paying handsomely for treatments, but also for the middlemen and the market power that they're behind. So how do you innovate? How do you make something that makes patients better without just bolstering profit margins?
That's right. And we're joined now by Halle Teco. She is the author of Massively Better Healthcare. She's a healthcare investor and an adjunct professor at Columbia Business School. Halle, welcome.
Yeah, thank you very much for joining us. You say massively better healthcare. It's the title of your book. But what does that mean in plain English? If healthcare is massively better, what would it look like? What would change from now?
Yes. And actually, one of the titles that we explored was 100x better healthcare. And the feedback that I got was, if you say 100x better healthcare, people are going to want you to quantify it. So that's how we ended up on massively better, which is, actually a term that we've been using quite a bit at the fund that I started called Rock Health. We say, we want things that'll make healthcare massively better. And we really look at the quadruple aim of healthcare, which is lowering cost, increasing access, improving outcomes, and then finally improving the experience for everyone involved, both patients and providers.
So much of the experience in the American system is built around a system that's frankly incredibly difficult to understand, incredibly difficult to access, and not just for those outside who are looking in at it, but for those who are inside trying to navigate it. When you say massively better, let me go back. You have this anecdote in your book, actually, that I think is really great, where you talk about trying to get a skin lotion, essentially, and then realizing through that just how convoluted the system was. I was wondering if maybe you could tell that here for a moment.
Yeah. I mean, the story I told was getting a prescription for eczema. And while I was writing the book, I had this experience, and then I used that experience to kind of talk through all of the stakeholders within healthcare. And there are just so many, some that like providers and payers, and then some that most people are not familiar with, which would be these middlemen, the PBMs, the wholesalers that are kind of sitting between you and the pharmacy where you pick up your prescription. Ultimately, the price that I got for this script was extremely high with my insurance. But when I kind of showed some shock at how high it was, the pharmacist over another pharmacist that was there at the pharmacy said, "Hold on just 1 minute." She put her fingers down on her computer, typed a few things, then said, "Oh, I got the price down for you if you just want to pay out of pocket and bypass your insurance." And I thought, how bonkers that I could pay out of pocket without insurance that's less than the insurance I pay $1,700 a month for. It is actually would end up being more expensive for this prescription. And I went to social media and I shared this experience, and it was the most viral post I had ever made because it was so familiar to everyone that, it's so convoluted. And for the price to have such wild fluctuations between patients really feels unjust to all of us.
I've had the same experience, by the way. I know this experience in which you go to the pharmacist or the provider and they say, well, I can prescribe this for you, but it's going to cost this much. But actually, let me see, maybe it's this pharmacy you want to go to. And they pull up an app on their phone and they say, actually, you know what? I can get it to you for this, or this person can get it to you for this. Person sounds really shady here, but I mean basically the right pharmacy. Moving on, you work with students, professionals, and entrepreneurs trying to really navigate this system, work within the system in some way. Why bring this book out now? What is it about this moment that really makes you want to say this is the right approach to trying to navigate this system?
Yeah, well, partially the reason was because I felt like I was in a place in my career where I had enough knowledge to finally share. And I was ready to kind of synthesize all my learnings, pull them all together and share. But it actually so happens to be an incredible time for the healthcare system in the US and really around the world, because we're at a breaking point. Costs are just soaring. They're becoming out of control. And we're starting to see an uprising of patients who are recognizing that this is a huge problem for themselves and speaking up about it and actually forcing change. So I think there's really never been a better time to innovate. All of this with all of the tensions that we're facing, coupled with tools that now exist that did not exist before, there's never been an easier time to start a company than today in 2026. So the timing worked out really well, although I can't say that I timed the book with the market. It was really timed for my own, when I was ready to write it.
Well, that's as good a reason as any, of course. But first of all, just very briefly, what do we mean by innovation? So who are we talking to here when we're saying this is potentially a playbook to innovate in the market?
Yeah. So, and I use the term innovator versus entrepreneur because while entrepreneurs and startups are a hotbed of innovation and new ideas, new products, new business models, there are also people that work within the system that are in positions where they can be innovative. They're innovators within maybe a more traditional organization. And so I really wanted to write the book for anyone who's interested in doing things differently and bringing forward new products, new business models that can help improve healthcare.
Okay, so it's the full gamut of things within the healthcare. So it could be if you're making an app or if you're making a device or trying to restructure things within a specific company. Okay, I like how you wrote in the book, you're not too much of an outsider to get it because US healthcare isn't built intentionally. It's not there to make sense. You're essentially saying that if you're confused by the system, don't wait until you feel like you know everything inside out because it's so convoluted. If you had to kind of explain the US healthcare food chain as briefly as you can, because it is, you wrote a whole book about it, of course. Who are the key players? Who has power in this system? And where do the innovators fit in?
Yeah. Oh, what a good question. So it'd be very challenging to take what is the longest chapter in my book and explain it in one line.
Sorry about
but
that.
the way I break it down, is providers, so the folks that are actually delivering healthcare,
The medical providers, the
payers,
doctors,
those
right.
that are, yes, payers who are, really the middlemen between you and that and paying for that care. And most Americans are on a plan that is funded by their employer, which makes the U.S. very unique, also creates a lot of issues. And then a lot of Americans are also on Medicare, Medicaid, VA. These are public, socialized pieces of our healthcare system that are paid for by the government, paid for by us, our tax dollars, but only available to certain people within the system. And then, of course, we have pharma and everyone around the pharma value chain. And then finally, I think the most important stakeholder, which is you and I, everyone that is experiencing the system as a patient, as a consumer of care.
Okay, and so what's the reason that the US seems to get world-class innovation, in healthcare and outside of healthcare, but still has relatively poor outcomes in parts of healthcare and certainly overall huge costs?
Yeah. I mean, if you look at our life expectancy, it is lower than other wealthy countries and our peer nations. We have the lowest. But if you actually look within those numbers, it is shocking to see how that life expectancy ranges based on where someone lives, based on the color of their skin, based on their socioeconomic status. And so while the US is, as you said, exceptionally good at producing cutting edge medical advances, new drugs, new devices, new software, we have an exceptional infrastructure and culture of innovation. Really where we fail is distribution and affordability. And for those who are lucky enough to be born in the right place and succeed in certain areas of their life, they have access to the best care in the world. But for most Americans, they really don't. And so it's really this disparity that has created a story of haves and have-nots in American healthcare.
When we talk about innovations, we think especially of anything that could bring the cost down for the consumer, for you and I. You write about how oftentimes within the system itself, the incentives are misaligned so that the insurers, the payer, is not actually incentivized to keep the cost down. Could you maybe talk about that a little bit?
Yeah. So when the ACA passed, when I was first coming into healthcare in 2010, it was really one of the biggest pushes forward for healthcare coverage.
The
and one of the
Affordable Care
incredible
Act.
things
This is
that
Obamacare.
Yeah.
Right.
this is Obamacare. And there were kind of many things that Obamacare did, but one of the things they did was drastically bring down the rate of uninsured, which was fantastic. That has been very successful. Another thing they did was, if you believe it or not, insurance companies used to be able to deny coverage to people with pre-existing conditions. So if you came to an insurer and said, I had cancer 5 years ago, they could say, no, we're not going to cover you. We will not take your money. And basically Obamacare made that illegal. I think that was a really good thing. And it's shocking to think that that was ever allowed. But one of the other things that it did, which sounds good on paper, and I do think that the principle of it is good, which is it capped insurers' profits at 15%. So they have to spend 85 cents on the dollar on actual care. So they can't just rake in all the money from premiums and not actually provide the care, pay for the care that you need. And this is like, the intention of that makes a lot of sense. This is called the medical loss ratio, or MLR. But what happened is, these are insurance companies. These are publicly traded, some of the largest, most powerful companies in the world. What happened was, if you cap their profits, the only way to grow is by growing the top line. And so they started to become more vertically integrated. They started to buy pharmacies, to buy PBMs, to buy providers. And so the companies just got a lot bigger. And actually, for them, they were able to make more money by the cost of care going up, because they were getting more premiums and they were still, they're 15%. They needed to actually have the cost of care go up.
Okay, so let's dig into the innovation side of things now. So how does the money find the place that it needs to go when it comes to something that you're very familiar with, obviously, investing? So what's the difference between just a clever product and a true healthcare innovation? And how does the money find what it needs to find?
Yeah, I mean, a lot of times it doesn't. A lot of times we, unfortunately, fund companies that make healthcare worse, that make healthcare less accessible and more expensive, and it takes up valuable resources. So I don't know if that's a good answer, but unfortunately, it doesn't always find the right way. And I think that founders, I talk a lot about this in the book, but we have. If you come to healthcare, I do think most people come with the genuine intention to improve our healthcare system for ourselves and our family members and our friends. And so really keeping an eye on aligning the margin and the mission, which is a whole chapter in my book, and ensuring that the business models that you're creating are aligned so that you're only profiting when healthcare is improving, and really avoiding what I call the icky zone, which are companies like, the example I give in the book is Juul, which was that e-cigarette maker. And they started recognizing that they were making a lot of money by selling their products and advertising their products to young people who had never smoked before. So they went from being a smoking cessation tool to a tool that was used for leisure amongst young people. And the US, which one of the great things that the US has done from a public health standpoint is curb smoking. It's one of the only successful public health programs that we have adopted more successfully than other countries. And Juul rolled back decades of progress in that by targeting young people who were vulnerable to these ads that basically convinced them to start smoking these e-cigarettes, and it continues to be a problem. But unfortunately, they were making more money by selling to these new users than by selling to people who were trying to quit cigarettes. So we see a lot of that, and I think people should just be aware that if you position yourself as a founder in healthcare, there is a way. There's so many problems to solve, and there is a way to align that margin and the money that you make with the mission that you're trying to accomplish.
It sounds like ideally a political solution would be something that you would want here, more reforms on the political level that would then take away this misalignment that you see in so many areas and make it harder to innovate.
Yeah, I think I think in some ways we need more regulation that supports that really supports competition, that supports healthy competition, that supports openness in the healthcare system. But then on other areas, we probably need a refresh of legislation that is holding us back in a lot of ways.
I want to ask you about one area of innovation that I find really interesting and that we've been talking about for a number of years is customized, individualized health measures, especially when we look at data, when we look at wearables, for example. We criticize the American health system for often being so reactive instead of proactive. You write about this in your book as well. That is, it's focused more on care than on preventative medication, that is, or preventative solutions and taking care of yourself, essentially. We also know that we have this huge gap in medical care for rural areas where they may not have access. What do things like wearables and these kind of new solutions like biomarkers, which at first glance seem very sort of high end or at least more focused on one sort of earning level or sort of level of prosperity, but they may also have a kind of appeal, or they may provide solutions to these sort of other areas that don't receive kind of healthcare, what kind of prospects do you see in them? I mean, where is this? Is it filled with solutions for these areas that are underserved?
I will say, at first glance, a lot of these tools, including the Aura Ring that I'm a big fan of, are expensive and do leave a lot of people out. But I do think that the direction that these innovations generally go as these companies benefit from economies of scale is that the price goes down and it becomes more accessible. So as long as it's going in that direction, I think this is a pretty fair way for a company to be introduced. Because if you're starting out, you have to price at a point where you have enough to reinvest and grow. And so I don't knock founders who have higher price points as long as they're making efforts as they scale to make their product more accessible. And a great example of wearables and any sort of personal health tools, because we're seeing an explosion of these options. And we're seeing a lot of patients who are really interested in managing and tracking their own health because the healthcare system has failed them. And in my mind, this is a great thing, right? More empowerment, more information, more the ability to self-actualize your own health and wellness is a good thing. Now, at the same time, we have to really protect patients from tools that are not effective, not FDA approved, not going to actually, tools that might cause more headache and scare than benefit. But I think overall, I'm very supportive of breaking down the walls and minimizing the paternalism that healthcare has been faced with for far too long.
I would just say that isn't a lot of the argument that a lot of the people behind the current healthcare system saying, well, we want to give patients a choice. And then they end up perhaps with too much choice. So, for example, you're having to compare pharmacies to find out which one actually has the lowest price rather than just getting a low price. Like,
how do you find the right solution?
Yeah.
How do you find it? It becomes a forest. It becomes a maze of different things. You go into a hospital and you're worried that you might get treated by the wrong doctor because they might be out of your network or this kind of thing. That is an illusion of choice in a way.
Yeah.
But choice without transparency is not choice at all, right? And when you do things like, need to find a knee replacement and you're given, you're maybe given one option from your health plan of this is the one that's in network, but how do you find the quality outcomes data? It's very, very challenging, even for the most savvy patient. There has been regulation now where hospitals have to publish their prices, which is, again, crazy to think about, that this is one of the only industries where you don't really know the price up front, and it's very challenging to price shop. But even more so, like understanding outcomes, because price and outcomes kind of, you want to look at them all together. And you're willing to maybe pay a little bit more for something out of pocket if you know that this provider is the best at what they do. But honestly, finding that data, as you said, like it's an illusion of choice because we don't have enough transparency in price or outcomes for people to make truly educated, empowered decisions.
But in this same vein, then, isn't it frustrating for you as an investor in this sector to have to balance this kind of speed that Silicon Valley wants, right? That we associate with startups of, go forward, break things right away, with the need for empirical evidence that you expect from a functioning health system?
Yeah, great question. And I think that a lot of founders have been burned by working with traditional tech investors who expect that sort of growth without understanding that healthcare is a special snowflake. I hate that it is, but it really is. I mean, and you really have to understand the power structures. You have to understand the regulatory nuances in order to, I say, you have to go slow to go fast in healthcare. There's really no there are no shortcuts that you can take. These are people's lives that are at stake. And so the sort of responsibility we have in healthcare is very different from what a founder in the gaming segment, for instance, would have to their users. And so, I think finding investors that are going to be understanding of the timelines and be really there for the long haul is important. And we do know that while healthcare companies take longer to reach, let's say, like unicorn status, they're actually end up being more durable companies that have better bottom lines, because these founders have built that whole infrastructure to scale in a way that is a little bit less sloppy than sometimes you see in other industries.
Okay, Halle, I'm going to give you a magic wand, and I want you to say, what if you could make one system level change that would make innovation better, easier, that it reaches patients quicker and can therefore be more effective? What would you change? What needs the most attention right now in the US? If you could, if we could push aside all of this idea of like finding a political agreement.
Yeah. Can you give me a few wands? I'd like a few wands, but if I were to just have one wand, one of the big issues within U.S. healthcare is that we have annual enrollment. We have one period of year, which is just ending now, where we can enroll in health insurance for 12 months. We cannot enroll in health insurance for 5 years. We can enroll in health insurance for 12 months. That means that the payer is only incented to invest in my health where the ROI can be accrued within those 12 months. Now, we all know preventive health is something that is a years-long investment. And now we're seeing things like GLP-1s, where incredible outcomes for people that are taking them, but
those are the
it's
weight
not
loss
going
drugs,
to happen.
right? Like the Wegovy.
Yes, those are the weight loss drugs, the Wegovy, Ozempic, not just for weight loss, but we're seeing benefits for lots of cardiovascular areas, for Alzheimer's, for addiction, all these incredible outcomes that we're learning every day, that we're learning about in these studies. But it's not going to be within 12 months. And that's why health plans aren't covering that. And that's why health plans aren't covering most of these preventive options unless they're required to do so. So they're required to pay for vaccines, for instance. And there's a certain level of things that Obamacare requires payers to cover. But in general, they don't have the incentive. Why would they pay for something that isn't going to benefit them and is going to only benefit their competitor 5 years down the line? So that is the one thing I would change, is some sort of portable, longer than 1 year insurance plan option. And this is something that, and I don't want to blame the health plans, because they're actually not allowed to do this. They're not allowed to offer plans that are longer than a year. In fact, they're not even allowed to go above and beyond in incenting you to stay with them in many ways. If you're on the ACA or you're a Medicare Advantage plan, these health plans have their hands tied as well, because they're not allowed to try to capture you and keep you within their health plan, because that is perceived as anti-competitive.
It always interests me. I find it fascinating about the U.S. for such a capitalistic society that it does not want to encourage portability in insurance, which then frees up labor so much more easily to move around and actually find the jobs they want to. Because when so much is tied to work, when it's tied to one specific employer, that is a major consideration for whether you stay or whether you leave. And so if you have portability, then you have flexibility, and then the right employees find the right employers. But I'm not sure that's
Steve,
going to happen anytime soon.
Yeah. You nailed it. Job lock is something that economists have measured. It is a major issue within the U.S. It also prevents people from doing things like starting companies or joining companies, because it's much harder and more expensive for small organizations to get health insurance for their employees. So it really is an issue economically. And a lot of people are saying, well, why don't we have something like where our 401k can go with you from company to company? Why don't we also do that for health plans?
I want to tie together several things we've talked about. We are in the middle of this demographic shift right now, in which so many people are they're entering that age in which they need more and more medical care. I'm assuming that's also driving so much investment in this area, because there is an increasing demand. Will the innovations that are being thought of right now developed, will they benefit this group, this cohort that's going into this period of their lives right now in which they will need it? Or is it really going to benefit later generations? How do you look at it? Because this is a window, a very specific window.
Yeah. If you're talking about boomers, I will say the one thing that they have going for them, and I just spent the holidays with my parents who are 80, and I can attest that they are very tech savvy. And the fact they spend more time on their mobile phones than I do, and more time than the teenagers
trying
do
to figure
as
out how to
well.
get the camera, trying to figure out how to get the camera work mostly. No, sorry, go ahead.
But they're comfortable with mobile phones.
Yeah.
They're comfortable with technology in a way that is sufficient enough to benefit from, I think, things like virtual care and digital health in general. So I'm optimistic, and as you said, it's a huge opportunity. A lot of them are in Medicare or Medicare Advantage plans, which mean that they can be part of a plan that is more invested in long-term health and preventive health measures. I'm an investor in a Medicare Advantage plan, and we work with a lot of what we call dual eligibles, which are people on both Medicare and Medicaid, which means both low income and elderly. And when you have that sort of model, and it's not a fee for service, it's more of a value-based care model, you do get more freedom as the provider and as the payer to invest in things that are just beyond what you would consider healthcare. So maybe you can also help them with getting to appointments, driving them back and forth, because we know that transportation is an issue for some old people. You can help them with like medication management. There's a whole host of things that really haven't been part of the traditional healthcare system, but we know impact the health outcomes that these organizations, these innovative organizations, can provide to this really important population. These are our parents. Like, we want to see them do well and live their golden years as healthfully as possible.
And so you mentioned already that not everyone has equal access to high-level healthcare, the best outcomes, let's say, in US healthcare, along so many different lines, whether it's where you're located, or it could be race, it could be even age, all kinds of different metrics. But when you look at it from your perspective of trying to encourage innovation, are you just seeing a lot of entrepreneurs saying, we'll start off with the rich patient, with the rich patients, and then go from there? And then, if so, how do you encourage people to put out these inventions and innovations for all equally?
Yeah, I see both. I see founders who are focused on products that are quite expensive and fancy and, really not equitable. And whatever, they're allowed to do that. And hopefully they can bring down the prices over time and impact more people. But there's actually a lot of innovation happening for folks who have been traditionally left out of the healthcare system, the disenfranchised patients who don't have access to the sort of care that they deserve. And actually, technology is a great equalizer in many ways. And so I do see both. But I do think that innovation can sometimes be an accelerant for disparity, and we want to avoid that at scale. And there are a couple of things we can do. We can focus on lowering costs and increasing access, so really thinking about those as kind of required in innovation. We can bake inclusivity into design, so not as an afterthought, but really thinking about how we can get to scale by serving all populations early on. And then we can measure who benefits and who gets left out, and just solve for that.
For some of these innovations that are coming up, for some of these startups that are really trying to get their product to the end user, are they going to the insurers? Are they going directly to the patient themselves? What is the best way? It is such a convoluted system, and especially if these are oftentimes maybe higher end products, I would imagine they're going directly to the patient. Is it because it is a convoluted system as well? How does it work?
It's all of the above. I will say, we have more now direct to consumer tools than ever. I'm not sure if you guys have heard of companies like Hims and Hers and Roe. These companies didn't exist a decade ago, and now they have millions of patients that are using them for getting medications, getting prescriptions and delivery medication that they might not have been able to get otherwise. So I think that we're seeing more and more of these direct-to-consumer options. However, most of these direct-to-consumer options, not all, but most of them are cash pay. And so we kind of go back to this problem of who actually can access that and who can't access that, and where does it become a problem. In some ways, you could say maybe it's freeing up the system in a lot of ways by increasing the accessibility, and AI is going to help do that even more, right? Bring down the cost of accessing care and improving health literacy and understanding. But, I always say this, like, our healthcare system had a chance to serve everyone equally and cost effectively. And what we ended up with was a lot of gatekeeping, 15-minute doctor's appointments, siloed medical records that are also scattered all about and not in one place, medical journals that are behind paywalls, and patients who are, frankly, including myself, really fed up with the healthcare system that is also extremely expensive, and way more expensive than our peers are paying in other countries.
And that was just a sneak peek of our podcast, which looks into the world of money and financial stories.
To listen to the full episode and subscribe, you can just click on the QR code that's on your screen right now.
And we'll be back, same time, same place, next week with even more. So thank you very much for watching. Bye-bye.
Bye.